Pennsylvania, more people are dying from COVID-19 in nursing homes than anywhere else across the Commonwealth. The White House is recommending widespread testing of nursing homes and staffs within 14 days. Matt Petrillo reports there is support here locally for this plan.
2,400. That's about how many people died in nursing homes in Pennsylvania alone due to COVID-19. Now some are demanding action.
He was taken to the hospital.
Carla Shallow-Lee was visiting her father through a window at a nursing home in Lansdale called the Gwinnett Healthcare and Rehabilitation Center when she noticed her dad looked sick, so she wanted him tested.
And he came out COVID-19, that he was positive.
Her dad is doing better now, but not everyone is so lucky. Pennsylvania health officials say COVID-19 deaths in nursing homes make up nearly 70% of all COVID deaths across the Commonwealth.
It does feel like a death trap. Any place where you have people who live in that close to one another, you're going to have problems with infection control.
Maryland and West Virginia are just some states that recently rolled out plans to test everyone inside nursing homes because of a high number of residents losing their lives. Now there's a growing push for that to happen here in Pennsylvania.
Why would it be so difficult to inject into the conversation with the people that are absolutely the most vulnerable?
The PA Senate held a hearing last week asking why testing is also not routine in the Commonwealth's nursing homes. Health Secretary Dr. Rachel Levine says only those showing symptoms are getting tested, but that could change.
We're going to talk about it. We have to talk about it before we can do it.
But on Monday, the White House announced it wants to see action, so it's urging to have 1 million tests done in nursing homes across the country over the next 2 weeks. I'm Matt Petrillo, CBS 3 Eyewitness News.
All right, Matt, thank you. And